do you ever feel, I mean, you have a lot of information and understanding of PDOC as a condition. Presumably sometimes when families talk to you, do you sometimes feel they don't really understand the diagnosis and prognosis? And what do you do about that?
Right. Yes, is the answer. I mean, I have a lot of empathy with the families here. Who does understand this stuff? I mean, you know, it's not something that you see in the wider media. You know, the way that these kinds of severe brain injuries get portrayed, you know, sort of fiction on television, doesn't really match up to the reality. So I think sometimes, you know, our role in the teams is partly about that normalising. You know, this is difficult to understand. You know, why should we expect them to agree with us? I think we do work with families, obviously, where we try to work together with them, to do sessions with them, to observe what they do with patients, to try and foster that collaborative aspect to what we're seeing. I think there are quite a lot of families who actually leave our service feeling different about the patient's diagnosis and prognosis from how we feel as a clinical team. I don't necessarily see that as problematic if it hasn't caused undue friction and certainly, you know, undue distress for the family, and it hasn't interfered with getting the right discharge planning and discharge destination and everything associated with that for the patient. My take on this is when I do teaching with the teams is, you know, our role is to be honest with families, to share with them the information that we have so that they know what we think. We have a duty to make that information as clear as possible and to answer all of their questions. We don't need to make them agree with us. And I think it's okay to get to a point where we're saying to a family, you know, you're seeing this, we've seen it with you, you think it means this and we have a different view, but it's okay, you know, we can have different views. We don't think it's going to impact on, you know, the person you love, and this is why. Do you know what I mean? It's really trying to, I feel like sometimes there is a temptation of clinicians to try and get families to agree with them. And it's interesting, isn't it? Because, you know, we're all bringing different levels of expertise. You know, the clinicians are bringing their clinical expertise. The families are bringing their, I've known this person all their life, or, you know, I've known this person for 20 years expertise. And I think very rarely is it fruitful to have a situation where you end up with everybody sort of locking horns. You know, I think usually you can get to a point where either you do get agreement or enough agreement, or you can agree to disagree, and it's all collaborative.